Okay, I hope I'm audible, visible. Okay, okay. I think now it's audible, visible. Chalo, sorry for the delay. As you all know, today was a very enterprising day. Today, so many things happen. So first is, yeah, I'll tell you. First was, yes, as we are on schedule, we are not behind. So we'll do today and tomorrow surgery, then I'll do the OBG. So we have covered all the major subject, PSM, medicine, physio, forensic, surgery we are doing now. Okay, OBG we also had a session. So how was session with Dr. Puneet? How was the session? Now today we'll not finish, we'll do tomorrow last session. Okay, yeah. So today again, actually sir was taking the session. Okay, so sir took session till almost 8:30, and what happened was after 8:30 his link was not ending. Let we were not able to end the links. Okay, so we could not end the session. You get my idea? So YouTube was not ending it, and we cannot start the stream before the previous link end, because at one YouTube only one stream is allowed. So that's why not able to end. So we're trying and trying. We tried multiple times, but we could not end the session, and it remained live till the very end. Okay. Only later on we were able to go to the YouTube account section, then find the like all the past link, got that, and able to end. So it was very difficult. Now is the volume low? Okay, I'll increase it, don't worry. So the very tedious work, as you all know. Let me check it. Yeah, I think, yeah, volume is less, I'll increase it. Okay, now check. Is the volume loud now? Ritika? Now check. Is the volume loud now? Yeah, I think now it's okay. Yeah, thank you very much. So today was a very enterprising day. We had meeting first with the students, meeting with FMG students who are going to the NMC. Okay, the one who are going to represent NMC. Okay, and once we talked to them, okay, we saw all their points. They were well prepared and they had very good points prepared. And 2 p.m. they called NMC. Okay, 2 p.m. so we all were there. Me, Dhawan sir were there. Okay, then we had Dr. Sakshi Oda, Dr. Vineet, Dr. Sushil Vijay, Dr. Khalil were also there. So we're all there, students were there. And 2 p.m. they said they will only meet the students, only students are allowed. So earlier we thought even maybe faculties will also go, but they never allowed the students. Only students were only allowed. And they first asked the name of the people who were given earlier. Okay, so one of that student was not there. Okay, so they were waiting for the student to come, but then they asked them to come. So 4 students went there. Okay, and they started giving their points. So around 3 p.m. they went inside after all this. Okay, and around 4 p.m. we were able to got this news that they have removed that discriminatory notice, and they have allowed all the students who are done their internship or doing internship or finish everything and got the completion, they can do their 1 year internship. No need to do 2 or 3 year internship for them. So that was, I think, very good thing. It removed the discrimination which was there. So the very good thing that this thing was removed. Okay, Baki, we are hoping, we are waiting, let's see. Yes, okay. So today's session will be around 1.5 hours, and tomorrow I'll take 3 hours. Total 4.5 hours is for surgery. Okay, so today 1.5 hours. The PDF is already there in the Google Drive. That's there in the description. You can just click the description and the PDF is there. So PDF is in description. Okay, yeah. So I'll discuss about that there. Okay, it's very, very important that we focus on this. Okay, volume still low. I increase the volume to max. Okay, Shushti. Don't know, maybe my batteries are low. Okay, I'll check biochemistry schedule and tell you. Okay, and whatever is missing, you people can get this from the previous session. Like sometime that day I had some issue in the studio or this Wi-Fi, so I could not take PSM. So I asked you to watch the last session PSM. and cover the PSM because time is more important. I'll just increase the volume more. I'll make it 170. Okay, I hope it doesn't cause a blast. So I think now it will be louder. Can you check it? Cause a blast. So I think now it will be louder. Can you check it? It's sufficient. Okay. Okay, so let's do the surgery. It's very important. I'll be starting with the general surgery now. Okay. Let's do it. Okay. So today's session is about our the surgery, and here we are learning about the important general surgery points. Okay, that what is wound, what is this, management of the burn, etc. So that is what we are doing. Okay, so I'll be starting. Good evening, Ved Prakash. Okay. Chalo. So let's start the session. Okay. So 72 pages, let's start. So we are starting with the topic of burn. So burn is 100% exam question. Let's do it now and we will be doing it for the purpose. So burn is basically anything which is going to damage your skin with the energy, heat energy. Okay. So there could be thermal burn, but we can also have electrical burn, chemical burn, even cold injury can be there. They all mainly damage the skin but can affect the underlying tissue also. So in case of thermal injury, we have the scalds. One of the most common is we have the scald like spillage of hot liquids. Okay, clear. Then flame burns, we have like fire, like you touch a hot plate or something. Flash burns due to the gas, alcohol or combustible liquid. That's called flash burn. Okay, and contact burn is when you touch a hot plate, etc. That is called as our contact burn. Okay. Now first question, what the degree? So there are actually first, second and third degree. Some books say it is as superficial or deep. So there are basically different kind of classification. I am giving you a summary of all. Remember, it could be superficial or it could be deep. Okay. Then it could be partial superficial or deep partial, or it could be full thickness. Now remember how to differentiate. First thing is, remember the very common thing is superficial is the one which involve only the epidermis. And if it involves the epidermis, it causes the best healing, no scar, because once you involve the dermis, then you start having the formation of scar, etc. So first question, only redness is there, pain is there, mild, very minimum swelling, and it heals without the scar. Okay, so remember that is the case. Now in case of superficial partial, the involvement is also the superficial part of the dermis is also involved. So what is involved? The dermis superficial, mainly the papillary region is involved, the papilla, dermal papillas. So these are papillas. Even the papillas are getting involved. Okay, and here blister is the hallmark. So blisters are formed once the vessels in the dermis are affected, that cause a leakage of fluid, and fluid filled blister is formed. So remember, if blister is formed with pain, redness, suspect superficial partial, and if there is no blister, only redness, pain, suspect our superficial. Now once you go deep, now you are affecting the deeper layers of dermis called as reticular region. So which area? Reticular region. Okay, paper will be easy. One more good this. Okay, so yes, I am telling you one more very good news, that paper is going to be easy for FMGs, and we are expecting almost 40% result this time. I'm the first one to drop this news to you. And how I know? But just remember, it's a faculty's word, and I'm just telling you this time the exam will be much easier, so it will be very good for you. So all FMGs should keep working, and I'm telling you, just revise and do it. Okay, maybe it can be more than 40% also, and if that is the case, bring sweets, bring all the gifts, and we are waiting for you to come to us. Okay, and NEET PG, so obviously it doesn't matter easy or tough. The reason is your competitor must be behind you. Okay, if paper is easy, then all get good score. If paper stuff, all get low score. But at the end, one will be topper, not the NTA or this NEET UG, where there are 67 toppers with 720 marks. Okay, and I think in grace mark giving, maybe in future they might even give 721 out of 720 also grace marks. Okay, why? Oh, you came like your computer shut down. Like I went to exam center, my computer shut down, so now they should give me this, but I solved one question, so I should get 4 plus 720, 724 is my compensation marks. Only you will get the AIMS, others will not get the AIMS exam. Okay, chalo. Okay, so let's continue. Now comes the next question. In case of the deep, that is third degree, now dermis is affected, and as dermis, the vessels are also burnt and even the nerve endings are damaged. So that's why no blister. So that's why blister is absent here. Plus can be painless. Some books say painless in case of this deep partial, but mostly it is said it could be painless. Okay, and there is no formation of blisters. So blisters are absent. So blister will be absent in this case. Okay, if it is going deeper and deeper. Okay, so that is when third degree the blister can be absent. So what can be absent? Blister. Plus in full thickness, even you are affecting the subcutaneous tissue. Okay, even bones, muscle, you can reach them, and there is a scar formation. Okay, so what is this scar or scaris? This is our black burnt tissue, charred burnt tissue. Just when you eat tandoori kebab, chicken some, so there is a black crust on the top, that is called as the, yes, scar formation. Okay, and it is painless. So which is painless? The, yes, initial are painful, the later ones are painless. So ये इसकी खास बात है बच्चों. Okay, now what are the cause of the death? 100% exam question. If there is a death, it is immediate. Earliest is asphyxia. अगर within few minutes the patient die, it is mostly asphyxia. Asphyxia we covered in forensic. Then hypovolemia is because of fluid loss. It is because of what? Either the person with burn, he will have loss of skin, so that's why fluid loss occur, and this fluid loss causes hypovolemic. Then kidney failure can occur because when there is damage to this skin, etc., body, it can create our, yes, kidney to not get enough perfusion, fluid loss, and kidney can fail. And late cases is septicemia, is the late case. It's a late cause, last or late cause. So that's why they ask you earliest asphyxia, early is shock, and late is kidney failure or septicemia. So septicemia is the case. Okay, don't worry. Okay, Amav will discuss that point later. Okay, clear? You are going to do very well. Don't worry at all. Clear? So you will get 1 year. Don't worry. Okay. Again, compensation is required only in the case you were not there at all, especially the duration of the classes, and then you need. Okay, if it's just for few months, etc., I don't think you need a compensation for that few months. Okay. Now we see our Parkland formula. Okay, now what is Parkland? Let's revise it. The Parkland formula is basically also called as the Wallace rule of 9 we apply for the correction. So Parkland is the correction of fluid. Now how do you calculate the area for the burn? We use basically what? So we'll discuss it later, don't worry. The area. So first question, remember, is the rule of 9. So how many 9s are there? 11 9s are there. So 11 9 कितना हो गया? 11 9 create what? It create our 99, and 1% is perineum. So the 1% groin or perineum. तो याद करना, underwear कौन सा एरिया है? underwear. तो underwear is covering 1% of body surface, but it save 100% इज्जत. तो याद कर लो, groin is 1, rest all are 99%. Okay, so कैसे देखते हैं? ये 1% है, बाकी सब कुछ क्या आपका 99, ये 1% है. कैसे? First is entire head and neck is 9. Okay, but newborn it is 18. So remember, adult entire head and neck is 9%. Then arm, both arm is 9. Then anterior trunk and posterior is double 9, that is 18 and 18. Then legs are 18 and 18. Okay, and remember, rough area, palm is roughly 1%. So let's say someone is having burn and you put your palm on the chest, 1 2 3 palms are covered, 3% is the burn area. So let's calculate with me. Can we do it? Can we calculate the area? Okay, so tell me what is for right arm. Right arm, how much is arm? We are discussing the, yes, Wallace rule. Yes, 9%. 9%. Okay, creating happiness. Okay, what is your anterior trunk? Chest area, chest and abdomen. How much is anterior trunk? Anyone? Anterior trunk. Anyone? Yeah, 18%. Then what is posterior trunk? That is also 18%. What is your right and left leg? Legs. Okay, right leg, left leg, 18 and 18. Okay, clear? And both arms will be 18%. So both arm 18. Okay, so how much? This is 90%. Are you clear? 90. And what is 9%? Head. So head and neck is 9, and 1% is perineum or groin area. underwear area. So what is the 1% underwear? It cover our complete what 9% rule. 100% exam question, they ask you the area and you should be aware and knowing that very well. Okay, okay, let's continue. So remember, in case of adult, head is 9, leg is 18. In children, the 1 year, okay, 1 year old. In case of 1 year child, remember, it is head is 18% and leg is 9%. Now what is going to happen? As this child grows till the age of 18 year adult, the head will decrease by 1% every year. So it become 17%, 16%. So decrease by 1 every year. Decrease by 1 per year. So that's why if it is 2 year, 3 year, what is happening? 1 decrease till the age of what? So this till 10 year. Till the age of 10 year, what is going to happen? Yes, so let me just show you here. So let's say, how do you calculate? So what's happening? This area is going to what? Yes, going to decrease, okay, in the child. So from the area of 18, it decreases to 17, then it decreases to 16 till it become 9. So 1 per year is the decrease till the age of 18. At 18, it becomes this. So that is why the child till the age of 9-10 year, it will be 18%. And then it decreases 1 per year. Okay, are you clear? So 1 per year. Okay, leg is reverse. Leg is 18% in adult. In adult, and it is 9% in child. So I hope it's clear. So that's where the difference is. The leg area is half of the adult in a child, but head area is double. So that is the case. So we need to correct it for the yes adult and this. Okay, so this is called as the Lund and Borders chart. Okay, क्या बोलते हैं इसको? Lund. तो बच्चों में क्या लगता है? Yes, Lund and Borders chart. क्या लगाएंगे? Lund and Borders chart. Are you clear? And what is the fluid correction formula? For that we use the Parkland formula, which I'll discuss very soon. That is the concept. Now management. So remember the question. First degree, okay, we give symptomatic care. Okay, symptomatic care. If superficial partial thickness, topical antibiotics twice daily and dressing change. So what is needed? Dressing is needed, which could be changed, and the dressing contains silver impregnated this. Okay, so mainly silver is the one. So what we are using? Silver is one which is the main anti bacterial agent we are using. Okay, clear? Now next question. If it is yes deep partial thickness, then we use topical antibiotics, clear, plus dressing change. And again, so almost similar. What we can do in case of our deep partial, we can go for excision and grafting. So that's why grafting, but grafting is the mainly done in full thickness. So here the treatment is the skin grafting and excision. So that's the case. Okay, so what is the first degree? Just symptomatic care. It heals very well. Okay, within few days. If it is superficial partial, we go for antibiotics with dressings. Okay, and the yes, which cream can be applied? Silver cream. So silver yes is the one. Then if deep, then we are again going, but we can add a step same as the superficial, but add the excision and grafting if needed. Okay, and in full thickness we have to go for excision and grafting. Yes, chalo. Next question is our fluid. Very important. Fluid is important because as the person lose the skin, the yes fluid loss occur, and that can cause our shock. Okay, so first we use our Parkland formula. Nowadays ATLS is used. So in the exam, if they don't mention anything, okay, or if they ask Parkland, you go for 4 ml into percentage burn into body weight 24 hours. That's the total correction. Okay, and half the volume is given in the initial, and then we give the remaining. So let's see that. So Parkland formula is 4 ml into percentage burn into body weight, okay, per kg and 24 hours. Okay, second question is nowadays we are using is the ATLS or modified Brooks, where we use the 2 ml rather than 4. So what is the 8? So remember the concept is 4 ml is park. तो park में कितने होते हैं? 4 लोग. पार्क में 4 लोग बैठ के 4 बातें करें, तो याद करना पार्क में दिस. ओके, क्लियर? See, scarring occurs in others. Remember, if dermis is involved, scar can occur. Okay, but if epidermis is affected, it heals very well, because you all know epidermis has the intense healing ability. It contains our germ cells in the stratum basale, so that is why it can heal very well. Okay, clear? So let's move next. So next is, what are we seeing? Yes, so I'll just ask you, so what is the fluid we give? So what is the fluid? So we are giving, yes, normal saline in Evans formula. Okay, colloids is also used. Okay, and 5% dextrose can be used in this case. Okay, mostly it is, yes, ringer lactate RL. Okay, so let's do a question. Okay, let's say a person is 20% burn. How much burn? 20% burn. Can you tell me what will be the story if 20% burn? So how much fluid is given as per Parkland? So I'm just mentioning Parkland. So how much fluid you give as per Parkland? Tell me. 20% burn hai. Okay, Parkland. Anyone? Parkland. 20%. How much? I can't see the chat sometime. I don't know what the issue is. Okay, so obviously 20%, so 20 into 4, okay, into body weight. So now we need to know the body weight. Let's say they are giving body weight as 50 kg. 50 kg. So now they are giving the body weight, yeah, body surface area. So let's say they are giving the burn area as this, then body weight is, let's say, 60 kg. Yeah, 50 kg into 50. So how much will be? It will be 80 into 50. How much? 4000 ml. Okay. Now out of 4000, how much must be given? So two part. So we give the half in 8 hours. So 2000 in 8 hours, and then remaining 2000 in 16 hours. So that is the correction formula. So half must be given in the first 8 hours, the rest is given in 16 hours. Okay, pediatric, there is Galveston regime that is used for the pediatric cases. Chal. Now let's discuss trauma. Remember, red is immediate treatment is needed, yellow is urgent treatment, okay, but we can wait some time. Green is, you can ask बाद में आना बाबा. Blue is expectant, okay, and black is disease, okay, Mori ban. Okay, my pen is not working, I don't know. Let me get other pen, 1 second, okay. What happened creating happiness? I told na, burn area into 4 ml into body weight. If body weight is 50 kg into 4, कितना आ गया? 200 आ गया. और एरिया देख लो 10 है 20 है, so 2000 होता 10 होता 20 होता तो 4000. That is the case. 1 second, okay. I'll get my pen, this other pen. That new pen. Next is, look at this. This is the triage 100% exam question. Red is most urgent. Okay, if you don't give intervention, patient is going to die. And what is the criteria? GCS less than 8, BP less than 80. Okay, 80, heart rate more than 130, and SpO2 less than 80. So this R plus airway is obstructed, stridor, we need to resuscitate immediately. Okay, orange is urgent, 15 minutes. Okay, we can wait up to this margin, so we have 15 minutes margin to give the treatment. Here the BP is less than 90, here it is less than 80. I'm telling you the main. Okay, GCS is, yes, less than 14. Okay, GCS is less than 14. Okay, and that is the criteria, main criteria. Okay, now if the other are there, it is yellow. In green, everything is normal. SpO2 is almost normal. 95 is taken as normal. Heart rate is normal. The GCS is normal. So all are normal. Okay. So if all are normal, then it is green. Okay. Now, what is the primary management? So first is A, B, C. This was asked in the recent exam. What is D? D is disability. Okay. D is disability. Okay. So let's start. A, airway management. If the airway is blocked by food, vomiters, clot, fallen tongue, we need to make sure that the airway are open and the person is using them to breathe. Else we have to intubate. Okay. Breathing. Okay. Then we need to give artificial ventilation. Then circulation, we give CPR or adrenaline. So adrenaline plus CPR. Okay. In this case, okay. Fine. Disability is basically GCS, Glasgow Coma Scale. Exposure is very important of the patient from head to toe, and F is fingers and tubes. So finger evaluation and Foley's catheterization. Okay. Now there is also RTS. What is RTS? Revised trauma score. What does it use? It uses Glasgow Coma Scale. It uses our blood pressure and respiratory rate. Only this you have to remember. So GCS plus BP plus RR. And grades are 4, 3, 0 to 4 grades. Okay. So this is the case. Okay. Volume I've already increased. I don't know what to say. Okay. There's some issue. My batteries are weak. I'll charge it tomorrow. Okay. Right now I can't change because the batteries are not here. Okay. They are in the other studio. So just bear today. Okay. Tomorrow I will change and get new batteries. Okay. आज काम कर लो आप. ठीक है. चलो. Next is, what is the neck trauma zones? Even these kind of questions are asked. First, zone 1 is below, yes, clavicle. Okay. Zone 2 is cricoid to the angle of the mandible. Zone 3 is above the angle of mandible. So this is the case. This is zone 3, above the angle. This is the angle of mandible. This is the zone 2. Okay. And below is clavicle. Okay. So clavicle, yes, to cricoid, then cricoid to angle of the mouth, and finally it is this. Okay. So clavicle. Next question. Diagnostic peritoneal lavage. So in case of blunt abdominal injury, okay, so what we do is we put normal saline or ringer lactate into the cavity and then we drain it out. This is called as lavage. Okay. So this is the, basically we can assess the fluid and check in this case. Okay. Now skin graft. So when we are putting a graft to the skin, okay, and basically what are the different types of graft we can use? Auto is same patient, like you take from thigh etc, put it on the, yes, other body area, that is auto. Iso is between twins. Iso ये question कई बार आया, twins. Allo is two different members of same species. Okay, two different members of same species like humans. So अगर आपने किसी और से लिया, भाई बहन किसे, ये आएगा allograft. Okay, and xeno is other species like your X. Your X is different species like snake, Nagin. Okay. Yeah, they do give a calculator in the exam and questions you can solve using the calculator. So even I don't have a experience. On 23rd, I will know how to use the calculator. So I'll be giving NEET PG on 23rd and then I will know the calculator. Okay. So X is xeno. X is xeno. तो क्या है हमारी X? X हमारी xeno में आती है. So X is xeno. Clear? चलो. Now transplantation. For transplantation we use MSC. What is MSC? Major histocompatibility complex. Basically MSC is involved in autoimmune disease and organ transplantation. Why? They indicate your self antigen, also called as HLA. Okay. Now you get it from the parents and that's why my HLA will be different from your HLA. But my brother HLA will be similar to me. That is why antibody formation is very much dependent on the HLA you inherit from your parents, and that is why we always do HLA matching for the, yes, organ, especially HLA DR. Also involved in diabetes, autoimmune, and HLA also involved in autoimmune diseases. Reason, if this HLA you are making antibodies, then they will be causing the autoimmune diseases. So autoimmune. Okay. Now very important, graft rejection. If it's a hyperacute, it occurs within minutes of vascularization of graft. The moment graft start develop vessel and get the blood supply, it get this because there are antibody already formed with destroyed. It's a type 2 hypersensitivity. The antibodies are there. MCQ. So type 2 is antibody reaction. So it's type 2. Okay. Type 2 antibody. MCQ. If it is occurring, okay, within few days to 3 months, it is called as acute. It is cell mediated. So it is cell mediated. So it is our type 4. So cell mediated is type 4. Okay. And chronic is after, yes, in the 12 months after the transplant. Not very common. It is due to late vasculitis. Okay. Late vasculitis is very common. But remember, if acute, it is 3 months. And again, it is type 4. Hypersensitivity. Okay. Now let's have a look at the wound. What is wound is? Wound is basically any break, damage to the, yes, our body tissue, including the skin. Now it can lead to multiple different classification. First is tidy versus untidy. Untidy, you can say, is basically the one which are not clean or might be having, yes, the pathogens. Okay. So it is inside wounds. Okay. Like surgical one. Then very clean, doesn't have the contamination with the pathogens, and healthy tissue are there, not disease one. Okay. Or dead tissue. Okay. And now comes the question, untidy, basically injuries. Okay. Crush, avulsion, traffic, RTA. So RTA, road traffic accident. Contamination is there. So we need to give antibiotics. Then the tissue might be dead. The blood vessel is lost. So loss of blood vessel. So as you lose the blood supply, it is devitalized. And finally, there is tissue loss. So that's when healing occurs. So more scarring when the healing take place. Okay. Now, let's see the classification. First is complex wounds. Okay. Simple wounds. Okay. Closed wounds where skin is covering, that we have covered in forensic. Contusion, abrasion, hematoma. Here the skin is intact. Okay. Then simple wound where only skin. Complex is involving other areas also. Tidy, untidy. Okay. Clean wound, contaminated wounds, dirty wound, open wounds which could be incised, lacerated, crush or penetration, stab injuries. We done that already. Okay. So this is something we have done already, incision, etc. in forensic medicine, FMT. I covered them very well. What is incise is, or incise or laceration which look like inside on the bony part. We have discussed that already. Okay. So let's continue. How does wounds heal? Remember, first is we are discussing primary intention. अब वो क्या चीज होती है? Understand. When there is a clean inside wound with a surgical scalpel or any very sharp blade, what happens? The margins are approximated with suture. So that's why very good epithelial regeneration. Okay. That is why scar will be very, very less linear, smooth, and it is supple. So that's why sufficient to, yes, cause the proper wound healing and closure. So that is why it is one of the best ones. What are the best? This is the best we can hope for. That is why if it occur, we know it's going to heal very well and less risk of, yes, the tissue opening up again. Okay. Secondary intention. In this case, if there's a loss of tissue, so that's why it heals much slowly. And the main thing is fibrosis because of collagen deposition. And it can lead to very wide scar, which can show hypertrophy. Okay. And contraction of wound occur afterwards. Okay. So hypertrophy of this, and then there is also reepithelialization with the remaining skin part. So that's why as you lose the germ cells of the skin, it is difficult to regenerate. Okay. So that is why it's very important that we have the skin not losing all the important, yes, layers in this case. Okay. Chalo. Now comes the very, very important, the third intention. Okay. Or tertiary healing. So in tertiary, it is also called as delayed primary closure. So what happens after the wound debridement, removal of every foreign object and control of infection, the wound is closed with suture or covered using skin graft. That's the case. Okay. Second, it is done for primary contaminated or mixed tissue wounds. So remember, if it's a primary contaminated, then they are using the tertiary intention. They are using the tertiary intention. Okay. Chalo. Now the stages, this we have covered in pathology also. First, there is the inflammation, redness, swelling is there, pain is there. Then there is formation of granulation tissue, that is blood vessel. So formation of blood vessels, they are very important by the vascular growth factors. This is called as granulation tissue. Okay. Then the skin cover, the epitheliation, that is the skin will grow. So skin will cover the defect. Okay. Then this scar formation. Okay. Fibrosis occur. Okay. Collagen 3 is there. Okay. So normally we have collagen 1, but in case of wound, there is collagen 3. And the cross linking is done by vitamin C. This was again a PYQ, MCQ. So what caused cross linking of the wound? Okay, fiber collagen. The answer is it is by vitamin C. That is why it prove the, yes, wound repair and the formation of the tissue. Finally, the maturation occur. Okay. Now comes the question, what is the management of the wound? So first question, if it is there, primary suturing is within 6 hours. Okay. Clean inside wounds. Delayed primary we have discussed already. Okay. It is we suture after within 48 hours to 10 days. Okay. If 6 hours it is primary. If 48, that is 2 days to 10 days is done mainly for laceration. And why? Because in this case there is severe edema and we need the edema to subside, that is delayed. And secondary is after weeks. Okay, that is 10 to 14 or later, done mainly in infected, so that we can control the infection. And once we see vessels are formed, that means the infection is in control, then we will do the secondary suturing. Are you clear? If you do the infection is there, it can cause pus formation and cause bursting out. Okay, that's why secondary we always wait for infection control. We keep giving antibiotics. Are you clear? Okay. Compartment syndrome, 100% exam question. Basically what happens, there's a deep fascia. Okay, so deep fascia create compartment. Okay, so due to deep fascia, due to thick deep fascia, so this create various compartments in which muscles are present, like anterior compartment, posterior compartment. So if there is but any kind of hemorrhage or excessive accumulation of blood or maybe other kind of stuff, it can increase the pressure more than 30 mmHg. Okay, and that causes our requirement for urgent fasciotomy. We open the fascia, relieve the pressure. Okay, and what are the finding is there is Walkman ischemic contracture. So what happens, as there is less blood supply, this causes ischemia then causes the muscle to go into sustained contraction, because we need blood, ATP, calcium, etc. to make the muscle relax. Now without them the muscle goes in contraction called as Walkman ischemic contraction. Okay, what is the diagnostic? It is pain. When you stretch the muscle, the pain is aggravated. This is called as our diagnostic sign. Okay, very common in calf muscle and forearm. Okay, now next question, scar tissue, very important. Two kind of scar tissue are seen, 100% exam question, done in patho also. Either keloid is काले लोगों में, kilo काला, so काला में क्या होगा, keloid. Okay, and remember hypertrophic scar is not kala means dark. So remember, very simple mnemonic is kala is keloid, kala means black. Okay, and hypertrophic is light color, is not dark color. Okay, so first is mainly dark people, so it is genetic. Africans very common. Okay, that's why genetic black people, so more in black, keloid कालों में ज्यादा होता है, काले रंग का ही होता है. ठीक है. Second, what is the site? This is the triangle. So is what? Chest, ear. Okay, and also the upper arm and the neck. So which area? This area. Okay, so neck, okay, chest and upper arm area. Clear? And it keep growing without any time limit, and it even goes out of the margin. So goes out of margin, that's the main thing. Okay, clear? So goes out of the margin, so cross the margin. तो कौन आउटग्रो कर जाता है? Keloid. Clear? And response is poor, can reoccur. Clear? So it is very poor response to the treatment and reoccur. Okay, whereas hypertrophic scar can occur anywhere. Okay, very common flexor. Growth is limited for 6 months. Okay, second, it is limited to the area where the injury occurred, and very good response to the steroid, and reoccurrence is very less common. Okay, now question one more is it occur mainly in adults and adolescents. Okay, and very common in female. Okay, and there is treatment. What is the treatment? Treatment is triamcinolone, which is steroid. Later, if not, we can even do excision of the excessive scar tissue. Okay, but main is steroid injection, intralesional. Okay, chalo. Now we'll discuss about the ulcers. What are the 3 ulcers? We have venous ulcers. Okay, we have the venous ulcers, then we have the arterial, neuropathic are diabetic, and pressure. Okay, so we have done already the neuropathic in diabetes topic. Okay, so they are basically because of diabetes, poor immunity, and also there is a bad source, etc. They all are basically neuropathic, mainly occur in the foot. Diabetic foot is the best example. Okay, then it is very deep, surrounded by callus. Okay, next question. Yes, that's the main thing. Then pressure ones are formed mainly in the area where more bony prominence is seen, like heel area. Here it is mainly occurring in the which surface? The yes, lateral to the fifth metatarsal, plantar aspect. So it's basically plantar aspect. It is mainly heels. So pressure one is at the heel, diabetic foot or this neuropathic because of loss of what happens as the person lose the sensation of the touch, etc. He is hitting the limbs very hard, and that can cause again involvement of the feet, that cause the Charcot limb. Okay, so Charcot limbs are very common here. Okay, finally the venous and the yes arterial. So venous is occurring any venous problem like varicose veins. Okay, so very common varicose veins, and also it is seen in pregnancy or DVT. Okay, so DVT, whereas diabetes again hypertension, Berger's, they causes arterial. Okay, now what is the case? First, the location is mainly lower calf and medial malleus. Okay, so lower calf. Okay, it is basically yes at the yes pressure points, toes, feet. Okay, these are area, toe and feet. Okay, now that's the main thing. The ulcer, it has basically shallow and flat margins. What the ulcer? Shallow and flat margins. That's the main thing. Okay, and slug, that is the dead tissue, is there at the base with some granulation tissue, which is causing the yes blood vessels formation. It is punched out. That's the main word. Word for arterial is punched out lesion, as if someone you put a very sharp thing and cut the margins out, punched out deep. So if there is flat one with shallow, suspect our venous ulcer. If punch out cut, suspect arterial. When it is in diabetic patient at the area of the plantar surface and it is showing also dry crack calluses, so that is suspect diabetic one. And if it is heel area, it is pressure one. Heel is pressure. Okay, chalo. Yeah, Galter's area. Yes, venous, we have Galter's area also. Okay, Galter's area. Okay. Now, in the case of venous, treatment is compression therapy, leg elevation. Okay, compression. Here we do revascularization. So very similar to treatment for stroke, MI, etc. We give drugs which are antiplatelet like aspirin, clopidogrel. Also, yeah. So revascularization. Stop smoking all. Here compression therapy. Okay. So let's move next. Okay. Electrolyte and nutrition. So first question, what is the case? So I skip this part because that is not asked much here. What they ask, I'll discuss that. First is shock. Now in the case of shock, there's a poor perfusion. Okay. And what are the types of shock and what is the case, I'll discuss. So first is I will be discussing, that is covered in medicine also. So I'll correlate with medicine. Okay. First is what are the stages, etc. First, stage 1 is normal BP. It's called as compensated shock. Compensated stable shock. Or if stage 2 is decompensatory, where the BP fall. So there is a BP decrease less than 90/60. So if the BP become less than 90/60, this is our stage number 2. Okay, that is the case. In third, there is now irreversible shock. So stage 3 is irreversible. Okay, that's the word. So now treatment will not correct the BP, and this is now severe hypoxia and multi-organ damage is there. Multi-organ failure and damage. Okay, that's the case. Okay, so this is decompensated. Okay, now let's continue. First is, let's discuss the shock. First, hypovolemic is basically volume is less. So all pressure and volumes are low. JVP low, heart rate will increase. Remember one thing I'm writing, heart rate is decrease in neurogenic, basal and can be septic shock, but I'm removing septic shock because in septic shock also the heart rate can be, yes, okay. So I'm just removing it. If they ask you, only go for decreased heart rate is neurogenic, there is loss of sympathetic and vasovagal shock, okay, and increase in others, warm shock and cold shock. Remember, warm shock is all except the hypo and cardio. Hypocardio, they are mostly cool. So remember, hypovolemic and cardiogenic, where heart failure is there. There is less pumping, less blood flow, less blood to skin. That's why they are cold shock. ये पूछा है कई बार आपका. जबकि others में क्या होता है? Vasodilation is there, so could be warm shock. So that's why warm. Others are warm. Okay. So कौन से दो आपके cold हैं? वो है hypovolemic और cardiogenic. ठीक है. चलो. So देखते हैं ये हो गया आपका. Then अगर heart fail हो गया तो heart rate increases, but JVP also increase, neck vein distension, edema is there. So edema is there, periphery is this, but also edema is there. Edema and S3 gallop. These are findings of cardiogenic. Distributive is massive vasodilation like septic shock, anaphylactic shock, neurogenic or adrenal failure. This causes warm shock. So which is warm shock? Distributive, there is a vasodilation. So what occurs? Again JVP will decrease because blood is not going to the heart because of excessive vasodilation. तो याद करना, अगर वेसल डायलेट हो गया तो ब्लड कहाँ इकट्ठा हो गया? वेसल में, हार्ट में नहीं आएगा. हार्ट में नहीं आएगा तो पंपिंग कम हो जाएगा. ठीक है. हार्ट रेट इसकी भी ज्यादा होती है. ऑब्स्ट्रक्टिव इज बेसिकली इमरजेंसी कंडीशन लाइक टेम्पोनार्ड, मैसिव effusion or tension pneumothorax. Again heart rate increase and here JVP increase. Backstride is seen in case of this. Again cold shock because heart is not pumping. Okay. Next question, what are the treatment and drug of choice? Cardiogenic shock, how do you identify? We see there is edema, pulmonary edema, basal craps are there, JVP can be increased. Here we give noradrenaline, the drug of choice, noradrenaline, okay, noradrenaline, okay, or dobutamine. Hypovolemic, fluids or blood is given. Here all volumes are low, heart rate is high, okay. Obstructive is the emergency, we need to remove the obstruction, we need to correct, like we do what? Pericardiocentesis in the case of this, on needle decompression. This is a tension pneumothorax, it's an emergency condition, okay, it's an emergency condition, and there is increased JVP also. Sounds are absent, heart sound absent. I'll just give an idea. Remember, if decrease BP, increase JVP, and heart sounds absent, suspect tamponade, cardiac tamponade. Okay, and if breath sounds absent, suspect tension pneumothorax. Okay, so tamponade I have already taught you. Okay, tamponade we have already done. In tamponade we need to do, yes, our pericardiocentesis. And if it's a tension pneumothorax, what we have to do? We do needle decompression. Needle decompression, MCQ. It's a 100% exam question. So we do a needle decompression. Okay. So now anaphylactic shock, drug of choice is adrenaline. Okay, 0.5 ml. Okay. And in case there is a itching, rash, we've done that in my medicine class. Septic shock, we give IV antibiotics and noradrenaline. Okay. So let me ask you, let's discuss the question first. If there is, remember, cold, which are the cold shock? Cold shocks are basically which one? Hypovolemic and cardiogenic. In hypovolemic, all volume low and pressure low, like JVP is low. Okay, clear? J. In cardio, there is increase CVP, increase JVP, PCWP, edema is there, S3 gallop is there. So all are increased, but they are cold shock. Easy. So they are cold shock. Okay. जो मैं बता रहा हूं इससे 100% क्वेश्चन आएगा. If you are not doing it with me, it's a major blunder. You are going to, yes, regret कि सर ये गलती हो गया, ठीक है। सो ये हो गया आपका कोल्ड, ओके। नाउ ट्रीटमेंट, हियर वी गिव IV फ्लूइड्स और ब्लड, ठीक है। देन इन कार्डियो treatment is, yes, we give noradrenaline, NORAD. So NORAD is the treatment of choice. Remember, if there's a edema, JVP, etc. Next question, warm shock. Warm shock, if there is the, yes, rash, itching, then swelling of lips, okay, face, then it is anaphylactic shock. Anaphylactic shock. So the anaphylactic shock, drug of choice, adrenaline, 0.5 ml IM or intra, this SC. So IM or SC can be given, okay, intramuscular or subcutaneous, okay. Dilution 1/1000. IV is 10,000, okay. That's the case. 100% exam question. That is warm, okay. Then if there is a history of infection, okay, then it is septic shock, okay, septic shock, okay. And here again body is warm, okay. Treatment is, again we give IV antibiotics, so IV antibiotics plus noradrenaline, again NORAD, again we give NORAD. And then if there is a history of spinal injury or surgery, then suspect it is neurogenic shock. न्यूरोजेनिक शॉक. सो प्लीज रिमेंबर, यही आपका आएगा, इसी से क्वेश्चन निकल जाते हैं फिर से. तो कैसे सॉल्व करना है आओ देखते हैं. अगर कोल्ड है बॉडी, ओके, कोल्ड है बॉडी, हाइपो एंड कार्डियो, आई डिफरेंशिएट. इफ बॉडी इज वार्म with allergy, rash, itching or some history of bee sting, etc., anaphylactic. If there's an infection, septic shock. If there's a spinal injury, it's neurogenic shock. Or the drug of choice, anyone? Again noradrenaline. NORAD is the treatment, NORAD, okay. So we give NORAD in this patient. And next question, what is there in the patient apart from that? So apart from that we will also be seeing what funda, आओ देखते हैं. ये हो गया. Now what about obstructive shock? Obstructive shock is basically again decreased BP, okay. And what it could be, so there's decreased BP, okay. It could be cold or warm, is not a main thing. So main thing is it's a sudden drop in the BP less than 90/60. And now if what is there, increased JVP and absent breath sounds, it is tension pneumothorax, TP. If there is absent heart sound, it is, yes, cardiac tamponade. So please remember, this covers everything that we need to know, okay. It covers all the shock and their management. 100% MCQ, 100% MCQ will be from this topic, okay. Chalo, let's move. Now classification of hypovolemic shock, so let's discuss that. So first is, remember what is the classification. If there is what 15%, it is class 1. If 15 to 30% is this is 30 to 40% loss, this is more than 40% loss. That's the main thing, okay. So that is the case, and we can divide into two categories. What two categories? These two. In these two, the loss is above 30%, low BP, and they are decompensated. These two are compensated. BP is normal BP, and they are compensated shock. Okay, now heart rate 100. So 100 normal, slightly increase, it is increased but not that much. So it is increased because 100 is tachycardia, but it is not very high. Here it's 120, 140. Okay, BP I told you is main thing. Pulse pressure, again it is normal here but decrease in other, okay, because of the falling pressure. Then capillary refill, again it is positive in this case because of, yes, the pressure is now getting lower and lower. Okay, respiration, it is very high. Okay, so 20, 20, 30, 30 plus, and it is 35. Urine output is again almost normal because till it is 30 ml per hour, it is almost normal. It is very, very less. So oliguria is there here, and urea. Patient is confused or maybe not responding, comma can be there. Okay, finally here mildly anxious, he is losing the blood but still conscious. Okay, and here we give crystalloids, normal saline. Here we give blood is the main treatment. MCQ, blood is the main. So blood is the main in this case. Okay, clear? Don't worry, I'll discuss that also. Don't worry at all. Okay, chalo. So what is the Q SOFA score? I'm writing it here. Okay, so write Q SOFA. Q SOFA. Okay, so first is, what is the Q SOFA? Basically there is thing, first is BP century, as BP less than 100 mmHg. Okay, RR more than 20 per minute, RR, and the Glasgow Coma Scale GCS 14 हो गया इसका, 14. तो ये बन गया आपका. तो याद करना RR 20. ओके, RR 20 है, SBP 20 है, और ये तो याद करना सोफा. So when you sit on a sofa, you are 100% relaxed. So 100% relaxed. Okay, and 20 is your, yes, rate respiratory, and GCS is almost normal, 14 or less. Okay, so it's 14 or less. Okay, 15 is normal, so 14. So 1 is lacking. This is the case. Okay, fine. And what about the SIR? So I'm writing SIRS also, SIS, SIR. So ASHISH SIRS. Okay, so SIRS में क्या होगा? एक तो टेम्परेचर. ओके, टेम्परेचर, ठीक है, आइदर लेस देन 36 और मोर देन 38, मतलब दोनों, हाइपोथर्मिया और हाइपरथर्मिया. ओके, रेस्पिरेटरी रेट 22 होगा इसमें, 22 से ऊपर. हार्ट रेट इसमें चेक करेंगे, अबव हार्ट रेट मोर देन 90 पर मिनट. सो इसमें हार्ट रेट लेंगे, इसमें बीपी ले रहे थे, एंड डब्ल्यूबीसी काउंट सर्स में, क्योंकि इन्फेक्शन है, डब्ल्यूबीसी आइदर लेस देन 4000 और मोर देन 12000. This is SIRS criteria, MCQ. So please, I'm not joking. Nowadays, one question always come from the classification. It should be clear to all of you. Yes, very good. Okay. So it is 14 of this. That is less than 15. Easy याद कर लेते हैं. सही कह रहा है वो. Easy है. इसको less than 15 लिख लो. तो आप सोफा पे 15 मिनट आराम करो, 15 से 20 मिनट. तो याद करना, गहरी गहरी सांस लो 20 बार, और 15 का आपका GCS है. ठीक है, GCS. ओके, चलो. सो आर यू क्लियर? सो दिस इज द केस. सो लेट्स रिवाइज इट. इट्स वेरी इंपॉर्टेंट. सो लेट्स डू इट. ओके, सो कैन यू टेल मी व्हाट इज देयर इन SIR and what is there in Q SOFA? Just tell me the name, because I have seen the question in the 2023 NEET. They only ask about the Q SOFA. What are the parameter? What is there? So question for you. Okay, पहले SIRS में क्या क्या देखते हैं? टेम्परेचर है, WBC है, हार्ट रेट है, और RR है. हार्ट रेट, RR. वेरी गुड. हार्ट रेट, RR. वेरी गुड डॉक्टर कृष्णा. तो रिमेंबर, टेम्परेचर, WBC. क्यों? देयर कुड बी लो टेम्परेचर ऑल्सो और हाई ऑल्सो. इन्फेक्शन में दोनों पॉसिबल है, कम भी हो सकता है. ओके, और बढ़ भी सकता है. Then WBC count again can be low, can be high. Heart rate again is high. So heart rate more than 90, RR more than 22. Okay, WBC less than 4000, more than 12000. Temperature more than 38, less than 36. Please remember 36, 38. Okay, 36, 38. Okay, that should be the case. Okay, chalo, let's move. This PDF I'll upload. please do this PDF once. You will get at least 15 to 20 questions from this PDF for sure. Okay, chalo, let's do complication after blood transfusion, hypocalcemia. Why MCQ? Because the citrate which is there in the blood, okay, acting as a calcium chelator, it chelates the calcium and cause hypocalcemia. That's why tetany can occur. So what are the finding? Hypocalcemic tetany, that covered in medicine. Okay, then hypomagnesemia. Why? Because there is a high volume of fluid which is magnesium poor, plus citrate again can cause decrease in the level of calcium, magnesium both. Hyperkalemia and hypo both occur. First, as there is the hemolysis of RBC from the storage, there is a RBC releases. So RBC, why? Potassium is inside the cell. So potassium is inside. Okay, so potassium from cells, it leaks. And if there is re-entry into the transfuse, so what happens? Transfuse are already losing their potassium. When you give in the circulation, they can retake, and as they retake, hypokalemia occur. And also there is release of stress hormone, that is aldosterone, which increases sodium, decreases potassium. So this stress hormone ACTH is released. ACTH will increase our cortisol, corticosterone, also aldosterone, plus metabolic alkalosis. Remember, acidosis is related with hyperkalemia, alkalosis with hypokalemia. So I'll write it here. Remember a rule. What is the rule? Rule is, right, acidosis associated with metabolic, just write alkalosis, with hyperkalemia, and alkalosis associated with hypokalemia. ठीक है, चल, thank you Dr. Akash. Yeah, it was great to see all the students fighting for their rights. Okay, now next question. Okay, so I'll just revise with you. Let's revise. What is there? Yes, decrease calcium is there, decrease magnesium. What about potassium? It could be both, hypo and hyper. Now in the exam, what you should mark? So I'm telling you, hyper is more common than hypo. So if they give you, I've seen lots of questions, they say which is not seen or which is seen, and they give both hypo, hyper. Most people think the case. If you choose one, go for hyper is more common than hypo. Okay, but yes, hypo can also occur after the blood transfusion. Both are possible. Okay, chalo. Now next question, what do you mean by the term massive blood transfusions? What do you mean by massive? If you replace entire blood volume within 24 hours, example 5 liter is my total blood volume, you replace more than 5 in just 24 hours, is the massive, or 50% in 3 hours. So remember, 50% in 3 hours, or whole body blood in 24 hours. So let's say total blood volume within 1 day, or our 50% in 3 hours. Both are massive blood this. Okay, yes. Now complications, mainly citrate is causing. So alkalosis and acidosis both can occur. Alkalosis is more common. Okay, alkalosis. Okay, clear? Then hyperkalemia causes arrhythmia or cardiac arrest, mainly in the diastolic period. Hypocalcemia, citrate toxicity, again very dangerous. Okay, it can cause ECG changes, it can cause QTC, shortening. Then depletion of coagulation factors, of risk of DIC, that is disseminated intravascular coagulation. Then dilutional thrombocytopenia, again hemorrhage risk is there, hypothermia is there. Okay, so these are all the complications of blood transfusion. Remember, alkalosis is more common than acidosis. Okay, hyperkalemia because of release of potassium causes arrhythmia, it is very serious one. Hypocalcemia, and then now remember, there's also Tracho and trolley. What is that? It is transfusion associated cardiac overload. It can cause heart failure. It can cause heart failure. And as you give excessive fluid, it can cause lung injury. Ali, it can cause ARDS. ARDS, acute respiratory distress syndrome. Okay, so lung damage can occur because of excessive blood volume given, or it can cause heart failure, that is due to overload, called as the TACO. So decreases the pumping ability of the heart and ultimately can lead to heart unable to maintain the perfusion of the organs, and that is heart failure for you. Chalo, good evening, Dr. Diyasha Bishwas. Chalo. Okay. Now this is very, very important. I've discussed that already. So 15, this, what is this? So remember, if the BP is above 90/60, it is stable shock. What is it? It's a stable or compensated. The shock index will be less than 1. What is shock index? Heart rate by SBP is called as shock index. Okay. And in the case of 3 and 4, the urine is less. So also there is oliguria. And respiratory rate is also very high, RR more than 30 per minute. These are criteria, okay? And the loss is very high, 30% or 40% loss, okay? Second question, it is called as unstable shock. It should be T missing, unstable shock. So unstable shock, okay, decompensated shock. Shock index is more than 1. So remember, if less than 1, it is stable. More than 1 is, yes, unstable. How do you calculate? Heart rate by SBP. Okay, heart rate by SBP. Treatment here we are giving is crystalloids. We are giving the crystalloids. Okay, here we give the blood mainly. Monitoring. Remember, monitor the urine volume. For adult, it should be more than 0.5. For child, it is, yes, 1. If it is less, it indicates the kidneys are not getting well perfused and they are not able to make the urine. So it should be more than 0.5 in adult and more than 1 in case of child. Okay. And finally, best indicator is pulmonary capillary wedge pressure or for fluid correction. We have fluid requirement. And best for prognosis. So prognosis, what is the best? So for the prognosis, the best would be our which one? Best. So prognosis, best is which one? Yes, it is our urine output. So urine output is the best. Chalo. Now comes the question, back to this. How do you give the fluids? So for fluid, remember, this is the, yes, gauge of the, yes, cannulas. So let's see what are the case. Remember Thanos. So Thanos in the movie, which movie we saw Thanos? So which movie Thanos was there? Yes. So he was having which color? So Thanos. So Thanos was violet color. Okay, violet. So violet is 26. Violet is 26 Thanos. Then he came from space, other galaxy, other place. Then he come to our solar system. So solar system, sun is this. So Thanos came from space to our solar system, sun. So sun is yellow, 24/7 we want sun. So sun is our 24/7 the surveyor. Daytime we get the sunlight, night we use the electricity made from sun, all hydro solar. Okay. Then blue, sky is blue. This is Thanos. Then pink, pink flower is there, pink flower. Pink flower is there. Okay. So what is there? Pink flower is there. Then green stem plant. White is the, yes, soil. Okay, which is white and gray color. So white and gray. Okay, gray is the soil. Okay, Then 17 is khatra, danger, we put 17. And what is there under the earth? Lava. Lava is 14, and it is the largest bore. Largest bore. So the largest opening, it is orange. It is used for rapid transfusion of the fluid or transfusion of blood. We should use the orange one. So orange is the, yes I know, oh great god, पर मैंने इसमें सीधा थैनोस को घुसेड़ लिया, ठीक है. So now even Thanos is there. So Thanos come from space. It is violet. Okay, violet is 26. Sun gives 24/7 sunlight. So sun is our what, 24. Then we have the blue. What the funda about the blue? Blue is our, yes, 22. Pink is 20. Green is 18. White is what? White. White is our, yes, which one? 17. Gray is 16. Okay, chalo. So now we'll discuss the breast. Now first is, remember what is the types of discharges we are having. So first, if it's a bloody discharge, okay, bloody, most common is our ductal papilloma. Okay, carcinoma could be there, or ductal ectasia. Ectasia is dilation. Pen is not working. Okay, so ductal ectasia. Then serous, that is liquid is there. Okay, so this like thin liquid which is coming, serous. Okay, almost like a water, like watery. Serous is watery. It is fibrocystic. So serous is cystic. So remember mnemonic, serous is cystic. So serous is cystic. Okay, and finally carcinoma and ectasia. So remember, carcinoma, ectasia can cause all. It can cause all type of discharges, ectasia and carcinoma. But if it's greenish black, it is again duct ectasia. But if they say bloody discharge, that is your ductal papilloma. Okay, and serous is fibrocystic disease. Now treatment. Ductal papilloma is a benign condition. We have to do the excision of the involved duct, called as microdocodectomy. Okay, we remove the excision of duct. Then ductal ectasia, we have Hatfield's operation, where again we do excision of the involved duct. So remember, if there is a ectasia, all type of discharge, all types in ectasia that we discussed. So green also can be there, bloody can be there, serous. If serous, it is what? Fibrocystic. So if serous, fibrocystic, which is most common. Now carcinoma, remember adeno are more common in higher. Remember mnemonic Adani, Ambani. If rich people like Adani, their family type having most likely this, whereas poor people, poor, उनको कहते हैं ना 2 स्क्वायर मील नहीं मिलती खाने को, ठीक है. उनकी जिंदगी क्या है, सिर्फ क्या है, इधर उधर क्या है, ये स्ट्रीट्स पे. तो स्क्वामस इज लो स्क्वामस. ओके, सो लो सोशो इकोनॉमिक स्टेटस इज स्क्वामस सेल. ओके, SCCs, it is AC, adeno. Okay, now remember carcinoma breast is adenocarcinoma mostly, and most common in female due to, yes, higher social status. Like example, Angelina Jolie, she had, yes, high risk of breast cancer. She got a, yes, preemptive removal of the breast, mastectomy was done in her. Okay, very high risk of breast cancer. Okay, now what are the risk factor? MCQ, advanced age. Remember, age is a factor for all cancer. Old people, high risk of cancer. So remember, cancer risk is always high in older people. Risk increase with age. Some say cancer is just what? Catching up with you always, क्योंकि म्यूटेशन होती रहती है. Western countries again high risk of breast cancer, higher socio-economic, they all cause adenocarcinoma. Alcohol intake, so it's very common in foreign country. They are mostly having what? High alcohol, social, plus fat, which obesity, increase, estrogen is there. Yes, like early menarche, okay, late menopause, nulliparity. Remember, if you don't have this, there's a high estrogen level, and late first full term pregnancy. ये सारे वेस्टर्न कंट्रीज में दिखते हैं. क्या दिखता है? अर्ली प्यूबर्टी, देयर प्यूबर्टी स्टार्ट वेरी सून, प्लस दे हैव वेरी लेट menopause. Sometimes they don't even have the kids. Nulliparity is never had delivery. Okay, no delivery, no child delivered. So So no child delivered. So they are all what examples of our, yes, high risk. Yeah, clear? So clear? So that is our case. आगे चलते हैं. Next question, what is the family history? Like BRCA gene, okay, very important. Then obviously could be, yes, co-relation with ovarian or endometrial carcinoma, okay. And then genetic is obviously BRCA1 is mainly for female and 2 is male. So 2 can cause males. Remember, ladies first. So first is 1, ladies is 1, okay, ladies is 1. Okay, now remember estrogen is, remember, very high in early menarche. So if you start early, your body will have more estrogen. The breast will be exposed to more estrogen from earlier. Let's say the, yes, puberty is, like it's much earlier, like age of 10, 11. So that will cause a longer duration of estrogen to act on the ducts, and it causes the increased risk of the carcinoma. Late menopause. So again, very long estrogen will stay in the body because of delayed menopause. Finally, also nulliparity. Females who deliver, they have more progesterone. So during delivery, progesterone is more. As you don't get pregnant, the progesterone is less, estrogen is more. So again, all this condition causes our what? Less progesterone, more estrogen. Okay, clear? Dr. Dashivint. Okay, and HRT, hormone replacement therapy. Now, and also radiation exposure. OCP and smoking are not a significant risk, but they are risk factor, okay? But they are risk factor for cancer, none the so. So, अगर एग्जाम में पूछे नहीं है, no, they are risk factor, but not significant, okay? And if there's a breastfeeding, it's protective for CA, okay? It's protective. Now, first is ductal carcinoma in situ, okay? DCIs. First question, remember, it doesn't cross basement membrane. So, what the meaning is? First is doesn't cross basement membrane. Doesn't cross basement membrane. That is called as in situ. Okay. Next, it can progress to invasive ductal cancers. What it can become? Yes, ductal. Next is we can classify on the basis of nuclear grades and necrosis. Okay. What are they? First, it is low grade और हाई. तो याद करना, हाई ग्रेड इज SC, सॉलिड एंड कॉमेडो कार्सिनोमा. लो ग्रेड इज PCM. PCM में क्या है? लो ग्रेड फीवर में क्या खाते हो? पैरासिटामोल. सो इट इज पैपिलरी, देन किब्रीफॉर्म एंड अवर माइक्रो पैपिलरी. तो क्या है लो ग्रेड में? PCM. तो लो ग्रेड फीवर में PCM लो, हाई ग्रेड में SC. SC मतलब सर्जरी करा लो. हाई ग्रेड डिजीज में सर्जरी, सॉलिड एंड कॉमेडो कार्सिनोमा. Investigation for ductal is this, okay, which is MRI is the choice, okay. And most sensitive is basically, yes, mammography if there's a calcification. So MRI is not good for calcifications, okay. Calcifications are given the best on the mammography, which is basically X-ray only. Treatment, if non-palpable, we can do the excision by needle localization with specimen mammography. We can do the mammography later. And low grade DCIS, we do lumpectomy. So entire lump will be removed, okay. Remember, they are not crossing the basement membrane, so they will not be causing metastasis because they are limited. So that is why lumpectomy plus radiotherapy can also be given. Are you clear? So remember, they have not crossed the basement membrane. They are not going to spread to other areas, okay. Now, next question, lobular carcinoma in situ. So it is lobular, okay. So here lobules are present in females, so it's mainly in female, not in male, clear. Then it comes from the lobular units of the ducts, okay, multicentric and bilateral. So that's why there is a high risk of bilateral. Remember, lobular, दो लोब है, so lobular is double, bi, okay. Then pathology, what you see? We see Indian file pattern. There's a case. So Indians are love. Indian love mother, parent. Indian बहुत ही lovely people है. Love क्या? True love. Oh my God, true love. तो इंडियंस क्या करते हैं? ट्रू लव. सो इंडियन फाइल पैटर्न एंड ऑल्सो म्यूकोइड. इंडियन क्या? थूकते बहुत हैं. इंडियन लव टू स्पिट. तो याद करना, इन्हें क्या हर जगह थूक देते हैं, गुटखा, विमल. तो याद करना म्यूकोइड ग्लोब्यूल. सो एम्स का निमोनिक क्या है? आई डिस्कस इट लेटर, ओके. पैथो कब लेंगे? अभी पहले ये खत्म हो जाए एक बार तो मेरा सदर्दी खत्म होगा कि बिफोर नीट आई डिड ऑल द मेजर सब्जेक्ट, पीएसएम डन, medicine done, physio I have taken already, then we have done the this PSM also. Now today we are doing surgery, tomorrow surgery done, and then we'll do the OBG. आज हो गया है. Dr. Punit Bhujani took a OBG session. I'll also take a OBG session. So that means we have covered all. Patho Dr. Aman Setia will be taking the patho session, and he's a very good faculty. So Dr. Aman Patho. So we are trying to give you all best faculties for you. So yes, he'll take patho, plus I will also take. So don't worry, it will be done. Okay, so date I don't know exactly, I have to check the schedule. Today I was very busy in all this going here and there meetings, plus offline session was also there. Chalo, is it clear? Okay, let's come back and discuss the carcinoma. Then clinical feature is lump with ill-defined margin. What the clinical feature? Lump is there, which is with ill-defined margin, plus neighborhood calcifications are there. Now again, treatment is observation. Chemo prevention is with tamoxifen or our raloxifene, which is selective estrogen receptor drugs. And finally, we can do prophylactically bilateral mastectomy. So what we can do? Bilateral mastectomy. Example, Angela Jolie had this bilateral breast mastectomy even before the cancer can develop. Now remember, most common histological type is, I told you already, is our adenocarcinoma. This is our Peau d'Orange. This is Peau d'Orange. So it's this dimpling. So Peau d'Orange is also there. Peau d'Orange. Okay. Now most common histological subtype is invasive ductal cancer. Least common is papillary. Least common is papillary. Most malignant is inflammatory breast carcinoma. MCQ, because there's massive inflammation, increased blood vessel can spread very wide. It's very malignant. Then least malignant is tubular, which has the best prognosis, and worst is our IBC. IBC, inflammatory breast carcinoma. Okay. Most common site of breast cancer is which quadrant? Upper outer quadrant. MCQ, because highest breast tissue is there. So upper outer. So याद करना ऊपर और बाहर, ऊपर और बाहर, upper outer quadrant. So upper outer quadrant. ठीक है. Then least common area is lower inner. उल्टा हो गया ना. So upper outer में क्या होगा? High risk upper outer, or if it is lower inner, it is less risk. Okay. So 10% is 6%. So minimum. It is maximum. So maximum, and it's towards the axilla. It's pointing towards the axilla. So it is pointing towards. So axilla is what? Outer side, na? So outer, upper, lateral. That is lateral. So outer, upper, lateral is axilla. So it's towards the axilla. That's why it can also metastasize to the axillary lymph nodes. Okay. Next question. It's spread through lymphatic. In fact, all cancer except the hepatocellular and the renal spread through the lymphatic. They spread through our blood. So most cancer spread through the lymphatics. Okay, cancers. Okay, sarcoma are blood, but it's not here. Most common site of metastasis is bone. So the most common site, it is our bone. Bone is the site. Lumbar vertebra is more common than femur, and femur is more common than thoracic vertebrae. Okay. Now carcinoma breast is most common malignancy causing osteolytic as well as osteoblastic secondaries in the bone. MCQ. So remember, MCQ is what is more common? Osteolytic. Blastic can also be there, which make the bone blastic. Most common cause of death in this is malignant pleural effusion is the most common cause of death in carcinoma breast. So clinical presentation is obviously this is our lump. So lump is the biggest finding. Could be benign, could be like malignant. Then in advanced cases, there could be distortion, asymmetry. One breast is big, other skin can be fixed to the this chest wall or the tumor. Then there is involvement of the nipple. Nipple can be retracted, deviation, ulceration also. All are there. Even it can be completely retracted inwards. Now, Peau d'Orange is the most conspicuous sign of what? Breast cancer. It is due to the edema, and then there is also permeation of lymphatics by tumor. It causes dimpling. So this is Peau d'Orange. This is the Peau d'Orange, which is seen in the case of breast cancer. Okay. So puckering is also there. That is wrinkling of the skin. It is due to the involvement of ligament of Cooper. So ligament of Cooper cause dimpling inward movement like this. So it cause a inward movement. That is the case. Okay. Now, what is cancer and cuirassier? So what is this? It is basically multiple nodules and ulceration in the breast due to the involvement of breast, skin and chest wall. So that is the case. So this multiple nodules, skin ulceration, it is called as our, yes, cancer and, yes, cuirassier. Now triple assessment, MCQ. What's triple assessment? Basically it is clinical, then imaging, and then tissue sampling. Biopsy is the best, or FNAC, fine needle aspiration cytology. Okay, so what are the main? It is clinical features like lump, okay, or maybe some other finding, discharge, etc., or skin having some lesion, imaging, okay, and finally this. Okay, now first we do is always mammography. So what is the first thing we do? Mammography. And what is the investigation choice for carcinomas? Biopsy. So remember what is done first? It is mammography, and biopsy is the, yes, most diagnostic. Best is biopsy. Could be true cut or core cut or needle biopsy. Okay. Now this is the screening. Age 45. After that we should do annual mammography. Also brain radiation X-rays are used. और द एक्सपोजर 0.1 सेंटीग्रेड. तो कितना होगा? 0.1 सेंटीग्रेड. एंड रिमेंबर मेमोग्राफी इज इक्वल टू 4 चेस्ट एक्सरे. ये भी एक बार पूछा हुआ है. व्हाट इज इट? इक्वल टू 4 चेस्ट एक्सरे. नाउ यू कैन डिफरेंशिएट बिनाइन मैलिग्नेंट ऑन मेमोग्राफी, एंड देयर इज समथिंग कॉल्ड एज बिराड्स. एमसीक्यू. व्हाट इज बिराड्स? इट्स ब्रेस्ट इमेजिंग रिपोर्टिंग एंड डाटा सिस्टम. बिराड्स. एमसीक्यू. व्हाट इज बिराड? एक बार देखते हैं. फर्स्ट इज incomplete assessment. Okay, that is called as 0. Okay, so that is not available information about the risk, so we need to do additional. One is negative. Now you do annual, like after 45 year we can go for annual mammography, or if there's a high risk again, then 0 risk of malignancy is 1 is almost like normal. Okay, 2 is benign, there is some benign lesion. Okay, we do annual, again there is 0% risk, both are benign. Okay, then in case of 3 may be benign, so we do a follow-up, and there's the risk. What risk? 0 to 2% risk of malignancy. Okay, 4 is suspicious of malignancy. So what is 4? 4 is suspicion of malignancy is there. There are 3 grade A, B, C. Low risk 2 to 10, if 10 to 50 or more than 50. C. So remember B is 50% mark, C is above 50%, almost it is 95. So 95 is there. So that's why 50 to 95 is C. Okay, less than 50 is B, and less than 10% is A, and 5 is obviously malignancy is there. We need to do the intervention, and very high risk is there, and biopsy proven. If there's already biopsy also, this is your 6. What is BCS? It's a breast conservative surgery. It is done in the case of early invasive breast cancer, like 1, 2A or 2B. That is the case. So we'll do the lumpectomy or wide excision, local excision with 1 centimeter margin, and finally we can do the quadrant. These are all the treatment options: lumpectomy, wide excision, or we can remove the entire quadrant also. Then we have other option like MRM, modified radical mastectomy or radical mastectomy. They all are the options for treatment of the breast. These are conservative ones. Okay, the above are the conservative ones. Okay, ये मैं आगे बात करूंगा. ठीक है, I'll discuss them later. Don't worry. Okay, clear? चलो. So these are all there. Don't worry. We'll discuss all. कि what is the, yes, sentinel biopsy? What are the lymphatic risk factors? What are the carcinomas? Okay, investigation, Paget's, all will be discussed. Don't worry. Phylloids. ठीक है, luminal AB, all are going to be discussed. Don't worry about that. Are you clear? चलो ठीक है, तो टेंशन ना लो. ये सारा देखो बहुत सारा है. इट कवर ऑलमोस्ट ऑल द टॉपिक्स ऑफ द ब्रेस्ट. सी, सो पेज 20 तक आपका ब्रेस्ट है इसमें. सो इट्स वेरी इंपॉर्टेंट. ओके, ठीक, चलो फाइन. ओके, चलो. सो ये आपका कंजर्वेटिव है, जिसमें क्या होगा? वी आर नॉट डूइंग दिस. तो लास्ट तो बता दिया मैंने आपको, MRM मैस्टेक्टमी. सो मैस्टेक्टमी इज लास्ट. सो क्या क्या है? कंजर्विंग. ये कंजर्विंग है, इसमें ब्रेस्ट बच जाती है. ओके, ब्रेस्ट रिमूव इन quadnectomy or mastectomy. Here the part of breast or whole breast is removed. Mastectomy, whole breast is removed. This is the case. Okay, so are you clear? So that's why what is lumpectomy? Remove the tumor. Or wide excision with a 1 centimeter margin, it conserves the breast. Can you see? The breast is not removed, breast is present. But if you are removing the breast, then it become our yes, breast removal. Okay, that is the yes. Chalo. Now how can we reconstruct the breast? So three methods. One is autogenous from the patient own tissue. Alloplastic is implants, or combined, can be both implant plus own, like skin graft to cover, and that is the concept here. Okay, then there are flaps. Just remember, most common flap used for this is tram. Okay, tram is most common flap. Okay, or could be LD, thoracoepigastric, multiple gluteal. So multiple area flaps can be taken. Could be abdominal muscle, gluteal. This all can be used to create the yes flap. Okay, chalo. So female with large breast, to maintain symmetry, we can use tram, flap implant, or old flap implant. Okay, most common time. Just remember tram, that is transverse rectus abdominis, which I told you. So this is you are taking from the abdominis muscle, and that is put as a yes new flap. Okay, tram is transversus yes rectus abdominis muscle. Okay, best flap used for breast reconstruction is DIEP, that is deep inferior epigastric artery perforator flap. Okay, so remember best, most common is tram, best is DIEP. So देखते हैं आ जाओ. So what is the conservative one? कौन है breast conservative? So breast conservative में क्या आएगा? एक तो wide excision, or we can do wide excision or lumpectomy. Whereas cornopia, we remove the cordon. Okay, or MRM, they are non-conserving. Yes, yeah, I'm tired because obviously whole day was spent. I came night 3 a.m. from Ahmedabad, then morning have to go have the meeting. Whole day spent in sun. It was so high, even my hands are having lesion now. Okay, so that's the case. Okay, so I will end the session here. Okay, clear? I'll eat something and I will, yes. And what are the best flaps? Best is which one? Who's the best flap for reconstruction? And who's the most common? DIEP, जॉनी डेप. तो याद कर लो जॉनी डेप. तो कौन है सबसे बढ़िया? डेप. सो जॉनी डेप, याद है जॉनी डेप. सो डेप, एंड मोस्ट कॉमन इज ट्रैम. तो ट्रैम इज द मोस्ट कॉमन. ठीक है, तो ये हो गया ट्रैम. ओके, चलो. सो आई विल एंड दिस सेशन हियर. टुमारो वी कंटिन्यू फ्रॉम हियर एंड वी विल फिनिश दिस पीडीएफ. ओके, क्लियर? तो अभी मैं इसको अपलोड कर दूंगा. आई विल अपलोड इट एंड देन टुमारो विल फिनिश. ठीक है, चलो. तो कल हम इसे करेंगे पूरा. अभी आई एम जस्ट एंडिंग इट. ओके, आई एम वेरी स्लीपी. आई विल स्लीप सम टाइम. ओके, and then tomorrow I'll finish. Don't worry, it's all topics are there. It will cover each and everything. It will be beneficial for you all. Okay, chalo. So let's finish it. Chalo, kal milte hain. Tomorrow let's meet. Class timing again 8 o'clock. I'll start the class 8 o'clock.